And like in my world, I talk all anatomy, and in y'all's world, you talk all skill. And sometimes I'm like,
Yeah.
wait. Start at that again for me.
Yeah.
So it's been great.
And that's how, yeah, how do we blend those together, right? It's like
Yeah.
I've already started recording because I think this is already going to be
Oh, good.
some cool stuff. But yeah, welcome to the show, Dr. Gardner. Like, do you get
Thanks for
tired of
having
hearing
me.
that? Yeah, it's like it's so cool. We
Well,
met.
what's funny is my patients call me Dr. Savannah because I see a wider range of patients.
Hmm.
Some of them being as old as 3 days old, and some of them being in their later parts of their life. But my
Yeah.
students, when I taught anatomy at a local college, used to call me Dr. Gardner. So I'd be out in public and I'd hear Dr. Savannah, and I'd put on that hat, and then I'd hear Dr. Gardner and just kind of sit there and I'd be like, "Oh, that's me."
What do you
um,
prefer?
I personally am a little bit more casual. I don't even, if you call me Savannah, won't hurt my feelings.
Yeah.
But I think Dr. Savannah is just a little bit easier. It's a little less aggressive sometimes.
Yeah.
So I don't really care. It's not something that I hold too near and dear.
Yeah. The doctor part's the important part. I think that's
I guess so.
yeah, to be recognized, like the work that you put in, and it's not easy, and the journey that you've been through is pretty fascinating. So I definitely want to kind of dive into that. So
Sounds good.
let's start with your backstory, because I think it is interesting, and how it sort of led you to where you are now is very prevalent. Talk about your early childhood, and that how, and I'm kind of teeing you up because I know a lot about you, but I want you to tell your story of like how that led to what you're doing now.
Yeah, so I grew up in Jupiter, Florida, and I think that's kind of where a little bit of my golf history starts from. But as far as my childhood goes and my sports goes, I was a baton twirler, which a lot of people are probably not familiar with that. You being in the Carolinas, you're probably familiar. You've seen it probably at college football games, but it's kind of a different sport. But there's a lot of similarities. It's a very skill-based sport. It's very individual, but also there's team parts to it. But that was really my focus as a child. And my sister, growing up, was severely disabled. She had a rare seizure disorder called Aicardi syndrome, which affects the eyesight. It affects the part of the brain that connects the two sides together. So it's that corpus callosum in the middle of the brain that helps the right side communicate with the left side, which is really important. The right side of your brain connects the left side of your body and vice versa. So any stimulus, like a loud noise, like someone slamming a door or dropping a fork on a plate, unfortunately, it would send her into a seizure. So we grew up in a very safe household, but my parents did a great job of giving me the ability to be independent and supporting my development academically, sports, and although we had to make some changes that I didn't really recognize as differences in my friends at the time. I still had a really unique childhood, but I think that led me also into healthcare. I grew up going in and out of the hospitals with her, and I always just knew that I wanted to give back to the field that gave my family so much hope. The way that I practice is very collaborative, and I know that you're a very big fan of collaborative care too, or
Yes.
collaborative work within your field. But that, seeing the doctors actually work together, she had an OT and a PT and a, neurologist and all these different doctors that would roundtable and work together to help her. Women with her condition are only supposed to live a couple years, and because of that collaborative care, and to attribute to my parents' care of her, she was able to live till she was 16. So
Oh wow.
I just saw
Yeah.
so many confounding factors come together that just really influenced the way that I wanted to go forward and help people with my story, and then go on to add knowledge to it. So that was a little bit of my childhood. She passed away when I was 14. That was the year that I was really taking off in my sport. And I was competing at the national level. I had just won my state title. And because of that, I was, practicing pretty heavily, overdoing it a little bit, as often our youth athletes do. And I suffered a back injury. So that led to bilateral fracture, which causes instability in my lumbar spine. The doctors at my age didn't really know what to do with me. So their advice was just to kind of deal with it, figure it out. And
Oh.
unfortunately, 3 years later, I had surgery. So that was kind of my start and end of what I thought was going to be my athletic career.
So let me
And that's,
stop you there just for a
yeah.
second. Yeah. So looking back now on the diagnosis that you got, do you think it was correct? Do you think surgery was the right way, or could you have done something now with your information and schooling that would have saved you from that?
My answer is yes, because there's a lot of confounding factors there. Knowing what I know now, I think the advice that I should have been given was to see a physical therapist or a
There you go.
chiropractor,
Yeah.
to look out into conservative options. My parents did the best they could with the knowledge that they were given, and they were always very good about getting second opinions, and they did that. And they listened to their doctors, though. And at the time, that was what we knew. I mean, there wasn't a lot
Yeah.
of research on pediatric fractures of the spine and instability, unless it was like scoliosis related. Now knowing what I know, I often treat a lot of athletes with my injury. And in fact, like 10% of the population suffers from it and they don't even know it. It's a very
Yeah. I
common
was
injury with
wondering
like
about that.
football players and
Yeah.
volleyball players. So now knowing what I know, yeah, I probably wouldn't have done the surgery, but at the same time, with how bad it got at one point, I'm glad we did it. So it's part of my story. And I think my patients that don't know my story and they come in with post-surgical pain and there's some emotional sides of it, I kind of get to call them out a little bit and be like, hey, I've been there right there with you. And this is proof that if you take care of yourself and you care to do so, you can get better and you can live a happy and healthy life and a pain-free life. So I think it gives me a little bit of respect amongst my patients sometimes, but also gives me a little leg up on them too.
Yeah, that's. I was hoping you would say that because it's. I mean, it's always hindsight's 2020, right? I mean, we
Right.
only know what we know at that time. Who knows? The technology probably wasn't as advanced as it is now. Like, there's a lot of things that have changed in both of our worlds,
Oh my gosh,
right?
yes. Even in the past few years.
Incredible. So continue. You go. You're in college. How do you like?
Oh
Here,
yeah.
let me back up. Let me back up because this is one of
Yeah.
the questions that when you were doing you got surgery. Like you probably felt like my dreams crushed, right? I mean, I know you were kind of following in your mom's footsteps. Is that correct? Right. She was
Yeah.
doing the same thing.
So
So how did you deal with that, and then how did you get through that and actually achieve your dream of playing in college?
Yeah. So when I had the surgery, the information we were given was like, this is I think they did it pro bono because they didn't really know what was going to happen.
Yeah.
And I remember coming out of the surgery and the surgeon saying, I did my best work and I hope it works out. But unfortunately, I don't recommend you doing any manual labor for work. And at the time, I wanted to be an athletic trainer. Um, he talked about never lifting heavy. My tumbling days were definitely over. I probably shouldn't return to sport to find other ways to love it, which at least he said something nice.
Yeah.
But I was crushed. And I remember laying in bed like, it's over. I had all these big dreams. My mom was a major out of Alabama and back when Bear Bryant was coach. So she had those glory days.
So
And I knew
cool.
that I had wanted to follow in her footsteps, but I just didn't know it would happen. But I persisted. I did listen to their directions, but I also pushed myself a little bit more and ended up being able to audition and return to sport within a year and auditioned at
Wow.
Alabama, made
Quick.
the team.
Yeah.
Yeah. And I relied on what I could do. And that's really how I look at my patients now is like, okay, what can you do? And let's work there. So it made me a little creative, but I was able to create a team a routine
Hmm.
and provide the skills that I knew I could offer to make me a great candidate. And I was selected. And it was the coolest experience.
Yeah, no doubt. Yeah, you were there for. I mean, it's been a pretty good run for the
Yeah.
football team, and you were there for a few national championships and a
It's
lot of.
been a rough start to 2024 for us, except for Nick Dunlap. We'll thank him for that. Roll
Yeah,
Tide. But
exactly, exactly.
but yeah, I was lucky. I never didn't. We went to a national championship every year I was there, so I recognize my privilege.
Oh my gosh.
So
So you're in college. Tell everybody kind of what you studied and like how that led you. 'Cause I think that was interesting as well to
yeah.
getting your degree and what you're doing now.
Well, I had different options at that point. I was kind of listening to the whole be careful with manual labor. And don't get me wrong, I had a lot of pain being a college athlete, but we worked through it.
Hmm.
But I was looking at sports psychology. I was looking at dietetics because my sister's condition, they actually took her off of all seizure medication and strictly treated her with nutrition which was like dumbfounding back in the 90s and early 2000s, but it saved her life really. So I knew that I was just kind of into holistic care, wanted that more conservative option. Um, you know, that's one reason I love Dr. McCabe. He's a huge sports psychologist, but I
Yes.
knew I just wanted I wanted hands-on care. I always knew that I learned from a hands-on perspective, I'm useless sitting in a lecture. I have to ask questions and take notes, or I just don't know what's happening. So I knew that if I was going to provide care, it needed to be something that I could apply manually. I was looking at different options. I actually randomly applied for a chiropractic internship. And at the time, I was terrified. I tell all my new patients when they come in scared, I went to my chiropractor the first time and I was in tears, but I survived and ended up one, so we're good. But I interned under them and very quickly fell in love with it. I was amazed at the amount of people that were touched by the care, and I kind of just put my trust in them and my faith in them, and realized they had a lot of knowledge. And I applied to where they went to school, and the rest is history.
So it was Palmer College. Is that the name of the college?
Yeah,
Yeah,
Palmer,
pretty.
Florida. It's in Daytona
Yeah.
Beach area.
Hmm.
Yeah. You tell me I'm going to Florida again, and I was like, done.
Yeah, because you grew up in Jupiter, right? So you're in the hotbed of golf.
Oh, yeah.
and and everything down there. So very, very cool. So talk a little bit about how that led you to. I mean, you're an owner. Like, I mean, you're skipping a lot of steps here,
Yeah.
right? So give us some detail. Like, I mean, I think it's got to be so satisfying to like be where you're at now, of like being able to run your own business, and you do such a great
If
job
I'm
with.
being, well, thank you.
Yeah, yeah, yeah.
If I'm being completely honest, I don't know how I got here, but I'm here.
Oh, come on, it's too
um,
modest.
well, I worked coming right out of school. Well, during school, I found a love for pediatric care very quickly, mostly because there was a big gap. I found that a lot of my professors, when I'd ask or raise my hand and say, like, how does this apply to an infant, or how does this apply to a teenager? They kind of just
Yeah.
stared at me with blank stares. And so that really keyed my interest. And I decided to go specialize more into pediatric care. Not that that's all that I treat, but I wanted to know as much as I could to help support that population, especially because when I was an athlete, and when most people are athletes, they're kids, and I once had a chiropractor business person tell me, you can't be a sports chiropractor and a pediatric chiropractor. And I was like, I beg to differ, because that's
Yeah.
the best time to develop an athlete. So yeah, I focused there. And then coming out of school, I moved to Columbus, Georgia. My husband's in the military, so they brought us to Fort Benning, and I worked in a traditional chiropractic office there, and it was a great job. I loved my boss. It was a great facility, and I had wonderful patients. And my patients did get better, but I just started to question some things. I was reading research and was wondering where we were missing the mark, because at that time we were just essentially just providing adjustments, and then we would use some soft tissue therapy, but I just wasn't seeing the results that I wanted to as quickly as I was, especially with pediatric care, because they get better very quickly if they're given the tools that they need.
Hmm.
So that led me to dive down a deeper path, and I knew that I wanted to get a really good diagnostic process, which led me to what we use is SFMA. And so I knew I wanted to do that. I saw that TPI offered it. And then my husband, being a really good scratch golfer, he
Didn't
was
know he was that
pushing me
good a
to do
player.
it.
Yeah.
Oh, he's pretty good. He
Okay.
played on the
Nice.
PGA Junior Tour when we were kiddos. So he won't admit it, but he's pretty good.
Nice.
But I think he, brought light to TPI as well. And at that point, we knew we were going to Pinehurst. So
Mm.
I've always loved golf. I've always wanted to play. I just was scared because of my own back injury. That was another thing I was told not to do. So again, intrigued my interest. There's a pattern. If I don't understand something, I learn more about it.
Yeah, that's what I love. Yeah.
But if I can't learn it all, I don't want to do it. So I just did the full track. So went out to do their medical level 3, and enjoyed it so much. It piqued my interest, and it's really changed the way that I practice. And, we kind of alluded to that earlier with technology changing the way that you guys coach as well. It's just such an evolving field, and objective findings and data is so addicting. And it's just fun to support players and athletes. And I'm in that stage of my life right now where I've left my sport, and in a lot of ways I struggle with that as a former athlete.
Understand.
But
Yeah.
I get to give back in that way and still support my players from the sidelines. So it's been really fun. And now I've got my little practice, which is growing, and I just love it. I'm very grateful. I go to work every day and it doesn't feel like work. And that sounds like success to me.
That's exactly what it is. Yeah. I mean, I was shocked when digging into, I was stalking all of your former podcasts and information that I could find about you, and adjusting like newborn babies, and the stuff you guys do with, pregnant women is incredible.
Yeah.
I really had no idea that was even out there. I'm sure that's helped so many